Hello, and welcome to the Sharp Psych. In this video, we will cover 4 treatments and therapies for mental illness. In today's society, mental illness is becoming an increasingly prevalent problem that impacts a sizable percentage of the population. It's important to recognize that mental health problems are real, and often debilitating conditions require proper treatment. While some people might be quick to dismiss mental health problems, it's vital to acknowledge them. In this video, we will discuss 4 treatments and therapies for mental illness that have been shown to be effective in assisting people in managing their symptoms and living a life that is meaningful. Before we get into these treatments, make sure to check out the links in the description for my best recommendations. And don't forget to subscribe and turn on notifications. The following treatments and therapies have been backed by scientific evidence. The first recommended therapy is cognitive behavioral therapy, or CBT. Cognitive behavioral therapy, or CBT for short, is a type of psychotherapy that's proven to be very successful in treating negative thought patterns and behaviors that have an effect on individuals' mental health. The aim of cognitive behavioral therapy is to assist people in realizing the connection that exists between their thoughts, feelings, and actions, and to instruct them on how to alter these patterns for the better. In the treatment for mental health conditions including anxiety disorder, depression, and post-traumatic stress disorder, or PTSD, this therapy is frequently utilized. Individuals receive assistance from CBT in recognizing the negative thought patterns and beliefs that are the root of their negative emotions. Negative thoughts such as, "I'm not good enough" or "nothing ever goes right for me" are common for people who suffer from mental illnesses like depression. Through cognitive behavioral therapy, the therapist would assist the client in recognizing these thoughts and challenging them with more positive and realistic perspectives. The therapist will then guide the individual in an adoption of new coping mechanisms that are healthy in order to deal with the challenges that life presents. In cognitive behavioral therapy, the patient and therapist work together to set goals that are attainable, and the patient's progress is regularly evaluated to ensure that the therapy is catering to the patient's requirements. CBT is well known for its effectiveness and results. As an outcome, many patients experience an uptick in their mental health within a relatively short amount of time after the beginning of the treatment. CBT is a powerful tool that allows people to take control of their thoughts, emotions, and behaviors, allowing them to live happier and a more fulfilling life. The second recommended therapy is interpersonal therapy, or IPT. Interpersonal therapy is a type of psychotherapy used to treat mental illnesses such as depression, eating disorders, and relationship issues. IPT focuses on the individual's interpersonal communication, which is the ability to interact with other people, and it believes that interpersonal problems play a significant role in the development of mental health issues. IPT aims to assist people in improving interpersonal relationships and reducing the symptoms of mental health problems. The therapist works with the patient in IPT to identify problematic interpersonal relationships contributing to their mental health issues. The therapist will then assist the patient in developing healthy communication and coping skills to aid in the improvement of these relationships. The therapy is structured and goal-oriented, and progress is evaluated regularly to ensure that the therapy meets the patient's needs. IPT is a short-term therapy that typically lasts 12 to 16 sessions. The emphasis is on the present moment, and the therapist and patient collaborate to solve current problems rather than explore past experiences. Due to this approach, IPT is an effective treatment option for people who don't have the time or resources for longer-term therapies. The third therapy that is recommended to treat mental illness is psychodynamic therapy. Psychodynamic therapy, also known as psychoanalytic therapy, is a type of therapy that delves into the unconscious mind and past experiences to help individuals understand the root causes of their mental health issues. This therapy is based on the concept that our present experiences and behaviors are influenced by past experiences, and that exploring these unconscious thoughts and emotions can aid in overcoming mental health problems. For instance, a person struggling with anxiety may have developed this condition as a result of traumatic experiences in childhood. Through psychodynamic therapy, the individual can safely and securely explore these experiences and emotions, gaining a deeper understanding of how they affect their current life and relationships. By working through these unconscious thoughts and emotions, the individual can learn new coping strategies and improve their mental health. Psychodynamic therapy often involves a long-term commitment. as it involves exploring deep-seated emotional and psychological issues. However, the insights gained through this therapy can be life-changing and have a profound impact on one's mental and emotional well-being. In a supportive and non-judgmental environment, individuals can work through their past experiences, gain a deeper understanding of themselves, and build a foundation for a happier and healthier future. Before we arrive to the last advice, make sure to check our channel for other exciting videos about psychology, and don't forget to subscribe. So let's get to the fourth recommended therapy, which is group therapy. Group therapy is a type of therapy that involves a small group of individuals who come together regularly to discuss their mental health problems and provide support to each other. This type of therapy can be particularly beneficial for individuals who are facing mental health challenges, as it offers a supportive environment where they can share their experiences and feelings and receive feedback and support from others who understand what they're going through. For instance, a person with anxiety may feel isolated and overwhelmed by their condition, but in a group therapy setting, they can connect with others who have similar experiences and form meaningful relationships. By working together and sharing their stories, group therapy participants can gain a better understanding of their mental health problems and develop new coping strategies to help manage their symptoms. Group therapy provides a unique opportunity for individuals to receive support from a community of peers and to learn from others' experiences. It also offers a chance to practice communication and social skills in a safe and controlled environment. The supportive and non-judgmental atmosphere of group therapy can help individuals feel less alone in their struggles and more confident in their ability to manage their mental health. People who are struggling with mental illness often find that medication is an effective option together with therapy. It's essential to have a solid understanding that medication is not a treatment option, but it can be of critical importance in the management of symptoms. For instance, a person who experiences symptoms of depression, such as sadness and hopelessness, may benefit from taking an antidepressant medication. Such a person may find that taking the medication helps them feel better overall. A person who struggles to maintain their equilibrium because of bipolar disorder may find that taking a medication that acts to stabilize their mood is helpful. It's essential to collaborate with a professional in the field of mental health to determine the appropriate medication and dosage that will work best for each specific individual. Although medication has the potential to be an effective tool in the management of mental illness, it is essential to approach it as just one component of an all-encompassing treatment plan. It can be used with other types of therapy, self-care routines, and a strong support network to get the best results for a person's mental health. In conclusion, it is vital to acknowledge that mental health is a complex and often challenging aspect of our lives, but it is also something that can be treated and managed with proper support and care. The four therapies discussed in this article, cognitive behavioral therapy, interpersonal therapy, psychodynamic therapy, and group therapy, are just a few of the many effective treatments available for people living with mental illness. It's important to note that each individual's experience with mental illness is unique, and what works for one person may not work for another. That's why it's crucial to work with a mental health professional and explore different treatment options to find the right fit for you. By doing so, you can create a treatment plan that addresses your specific needs and helps you manage your symptoms effectively. Moreover, in addition to seeking professional help and undergoing therapy, self-care and building a strong support system are also key components in managing mental health. Engaging in activities like exercise, mindfulness, and spending time with loved ones can help boost your overall well-being and build resilience. Remember that mental illness may present a range of challenges, but with the right treatment and support, it can be effectively managed. You don't have to go through this journey alone, and there are many resources available to help you on your path to recovery. With the right combination of therapies, self-care, and support, you can lead to a fulfilling life and manage your mental health effectively. Thank you for watching. We hope that this video has provided you with valuable information, and I will see you next time.